This morning, more than 1,500 kids in our area have some sort of surgery each and every year. And while that may sound rough, some of these, they're minimally invasive things. So we're here to talk to us today about surgery and pediatrics. Dr. Jeffrey Dehmer, a pediatric surgeon with New Hanover Regional Medical Center, talking about the surgical side of pediatrics. For someone that's gone through so much school, this is going to sound like the dumbest question. What is the difference between a pediatric surgeon and a surgeon that would operate on someone my size?
Well, that's a great question, and really there's not much difference, but probably the main difference is that although everyone, when they do general surgery training, does some pediatric surgery, people who are board certified in pediatric surgery actually do 2 additional years of training just specializing on operating on children. And so just in terms of volume of cases that you see, those 2 extra years give you a lot more experience to go forward in your practice.
Yeah, I always wondered, because we hear so oftentimes a shortage of people doing peds, and I had wondered if there was a psychology behind it, that maybe it was a bedside manner, that you really had to specialize yourself geared towards dealing with kids. I was always curious about that.
Well, I do think you sort of self-select into pediatrics, whether it's surgery or the medical side. I can say that my perspective on it definitely changed when I had my own kids in terms of dealing with the parents and being empathetic and also being able to goof around with the kids too. What
are some of the things that you see that may be more specific to where we live? I would think there's got to be things that involve the beach, the water somehow.
There are, unfortunately. Obviously shark bites are kind of a very common thing. Near drownings, those are not typically surgical conditions, but certainly shark bites can be pretty serious and limb or life-threatening.
As far as school goes, with the kids getting back into the grind, do you see things school-related, and if so, do you see maybe an uptick in that as a school season begins, because for some it is new?
Not necessarily. I mean, kind of the routine things that we see are perennial. Appendicitis is probably the most classic example. Many parents worry about how much school their child is going to miss after surgery, but like you mentioned, with minimally invasive options, the recovery time can actually be a lot faster.
I want to ask you quickly, as far as at New Hanover Regional, I know when I first got here, it was always, let's go to Chapel Hill, where you said you're from, let's go to Duke. Your outfit there has become so well-versed in everything. Is that also now the case with peds?
That's the goal, and I think from a surgical standpoint, we're pretty close. There's 2 of us now, and so we're available 24/7 for pediatricians in the emergency department and the surrounding hospitals to send kids our way. And really, in terms of surgical options, we can offer pretty much everything that a larger academic center can.
Yeah, which is great knowing, again, parent yourself, parent here. It's nice to know that that's here, and it's also nice to know that when you go, you get things like this.
That's right.
I'm just going to go ahead and put on, because why not?
So we're real big on kind of providing a kid-friendly experience, and so one of the things I talk to people about in clinic is, what is your child into? And I have a collection of hats, most of them gifts from my own kids. Star Wars is my favorite, but we have Lightning McQueen, Curious George, all the litany of superheroes, and it really helps put the kids at ease, I think.
Yeah, I was going to say that the psychology behind it has to come into play at some point. I appreciate you coming in this morning, Doctor.
Yeah, pleasure.